Yesterday, we learned former President Joe Biden has been diagnosed with prostate cancer that has spread to his bones. His office says he was having symptoms and doctors found a small nodule on his prostate. We know a lot of you likely have questions about the former president's diagnosis and really what everything means here. So I spoke with Dr. Yamoah at Moffitt Cancer Center. He tells me the most common site for prostate cancer to spread is the bone. It's often known as the second home for prostate cancer. We also know Biden's cancer has a Gleason score of a 9 out of 10. The doctor tells me the Gleason score is how doctors grade prostate cancer, and it's based off how the cells look under a microscope. Biden's office says the Gleason score of 9 represents a more aggressive form of the disease, but the cancer appears to be hormone sensitive, which allows for effective management. I asked Dr. Yamoah what that means, and here's what he told me.
Prostate cancer cells feed off testosterone, the male hormone, right? So the way to think about it is that the male hormones do not cause the cancer, but it fuels the cancer. And so when you recognize that you have mostly unfavorable intermediate risk, high risk, or metastatic disease, the first level of therapy is anti-testosterone, which is a hormonal therapy. What it does is that it cuts off the nutrition, the supply of nutrients to the prostate cancer cells because they feed off the testosterone. So you starve them, and by starvation, you're able to actually weaken the cells, and then you can add on other therapies to destroy the rest of the cancer cells. So the best news is when you have these cancer cells hormone sensitive, meaning that they are responding well to the hormones and they are not what we call castrate resistant or hormone insensitive, because that's where you have to come up with other techniques that can be a little bit challenging to treat.
And according to the American Cancer Society, about 1 in 8 men will be diagnosed with prostate cancer during their lifetime. A PSA test can detect signs of prostate cancer, but is not routinely recommended by major guidelines for men over the age of 70.